UNICEF has released data detailing the number of children who've missed routine vaccinations during the Covid-19 pandemic in Africa. Immunization helps protect children from their killer diseases such as polio, measles, hepatitis B, diphtheria, tuberculosis, and meningitis. Joining us is Dr. Lesley Bamford, who is a specialist at the National Department of Health. Dr. Bamford, thank you for making time for us. So, 30% decline in confidence in childhood vaccines just in South Africa. What's behind this trend?
So, good afternoon and good afternoon to the viewers. So, with regards to vaccine confidence, we know that vaccine hesitancy was a factor with regards to COVID vaccination. And of course, there are some concerns that this will spill over into childhood vaccinations. In South Africa, we historically have a strong childhood vaccination program. We reach the vast majority of children in South Africa, although approximately 15 to 20% of children remain under-vaccinated. So we know that there is a lot of work to do because we are committed to reaching every child. But historically, we have had high levels of vaccine confidence with regards to childhood vaccination.
Yeah.
Now, we have seen this report in the State of the World's Children about a steep decline in vaccine confidence in South Africa. We are not aware of the data supporting that conclusion. And so in the coming days, we will follow up so that we can better understand the findings of that particular study. To date, we have not seen any, real proof that vaccine hesitancy related to COVID vaccination has spilt over into childhood vaccinations. But of course, that is something that we are very concerned might happen and are monitoring as closely as we can.
Yeah, especially because, children are children, and it's mostly adults during the COVID-19 pandemic that we saw some being hesitant when it comes to, the COVID-19 vaccine. So it will be interesting to finally have the definitive research on whether or not that's now spilling into children's vaccines. Currently, Doctor, do we have any shortages of government stock vaccines for children?
So in the past 2 to 3 years, we have not had any national stockouts of our vaccinations. In the past, occasionally there are global shortages of these vaccines, and that puts us in a very difficult position. So there have not been any national stockouts. That said, we do have some challenges with provinces not procuring sufficient vaccines to cover all of their children. And we do have some challenges with our supply chain. So we are working very hard to ensure that every facility has every vaccine all of the time, because clearly that is absolutely critical. And when our children are taken by their caregivers or guardians to a facility for immunization, we have to be sure that vaccines are always available. I think good progress has been made, but we do know that there are still incidences where an individual facility may be out of stock for a period of time.
Yeah, and just to clarify, are you saying that there's a problem just globally with the supply, or are the challenges you're experiencing coming from our side when we want to procure the vaccines? Is that the challenge, or are we talking here about the shortages in supply globally?
So currently, and for the past 2 or 3 years, there have not been any global challenges with regards to childhood vaccines.
So what's the challenge then on our side? If the supply is sufficient, do we not have enough money? Are we ordering them late? I'm trying to understand what's the frustration on government side?
So at a national level, our responsibility is to ensure that the depots in the country always have vaccines, and we are confident that is the case. However, one of the challenges with a program like the vaccination program is that those vaccines then need to make their way to each of our approximately 4,000 primary health care facilities across the country. Now, we do monitor on a weekly basis, and we know that most of the time, all our facilities have all the vaccines in stock. But there are isolated incidences where a particular vaccine may be out of stock for a short period. And as I've indicated, we consider that to be unacceptable. So we continue to work with our provinces, with our districts, and with our partners so that we can get to a situation where we can be confident that, as I've indicated, every vaccine is always available in every facility.
All right. So for people who go to a public health facility and it's a facility that's experiencing a shortage or they're out of stock, what do they need to do?
So there are a number of options. We would hope that all of our pregnant mothers are registered on the Mom Connect program, and using that they can send us a message or phone our national call center to report any stockouts.
All right. Dr. Lesley Bamford, specialist at the National Department of Health, thank you for making time for us. We'll be back with more stories when we return. Stay with us.